Complex regional pain syndrome is a complicated neuropathic pain disorder with pain far above what you would expect for a given injury. In this video, I'll discuss what this condition is, its signs and symptoms, and the risk factors for developing it. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation that you deserve. Complex regional pain syndrome, CRPS. It used to be called reflex sympathetic dystrophy, but now, again, complex regional pain syndrome. It's a neuropathic pain disorder. It's ongoing pain disproportionate to the degree of tissue injury, and it persists way beyond the usual expected time for tissue healing. Pain with this syndrome is accompanied it's not just pain. There's sensory findings, motor findings, and autonomic abnormalities. Those abnormalities include hyperalgesia, or very excessive pain when you touch a particular area, allodynia, pseudomotor and vasomotor abnormalities, meaning discoloration, trophic changes, meaning hair loss or hair changes in the area of injury. And the pain doesn't typically follow a specific area, a specific what we call dermatome, a patch of skin in relation to a specific nerve, or a specific myotome, specific muscle innervated by a particular nerve. It's more of a regional area, a certain part of a leg or a certain part of the foot. Typically develops after a trauma, after a fracture, or after a surgery. Now, this is probably more technical than you need to know, but there's two types. There's type 1, what used to be called reflex sympathetic dystrophy, and a type 2, also known or formerly known as causalgia. Type 1, the reflex sympathetic nerve injury, typically happens where there's no nerve trauma. Type 2 involves an injury where there was nerve trauma. They look basically the same on history and physical exam, and so we don't get terribly worked up about the certain type. This is a really tough condition. It affects sleep. It affects your ability to do your activities of daily living and your function. It takes a significant toll on the mental and psychosocial health of the affected patient. Again, it typically occurs in varying degrees due to trauma. Typically, it's some type of fracture, a tibial shaft fracture, a fracture of the foot, something like that. Surgery can do it as well. Other things, it can be occasionally sprains. I've really never seen it much with that. Contusions or bruises. I have seen it with crush injuries, especially crush injuries of the foot, and again, surgery. Typically, psychological distress. The patient will definitely experience that, and you see that as a physician when they come to your office, associated with physical injury along as this process starts. And that psychosocial distress plays a role, unfortunately, in the prognosis of the condition. Again, symptoms, not just loss of sensation or change of sensation and motor function, but again, some of those autonomic nervous tension, non-painful stimuli cause pain. Painful stimuli cause exaggerated pain. Skin color and temperature changes to the skin. Swelling, sweating changes. You can have motor changes like weakness, decreased range of motion. You have tremor of the affected extremity. And it causes mental health issues, depression, anxiety, and diminished quality of life. It's a very, very difficult process. And given how debilitating it is, it really requires aggressive management. It's not typically just the orthopedic surgeons. It's pain management physicians and a number of others. Neurologists a lot of times are involved in this because there's a number of different medications sometimes that are involved in treating. There's physical therapy, a number of different things that are involved in the optimal management of this condition. Physical therapy, occupational therapy, and again, medications, behavioral therapy, a number of different things to try to get it better. And so it's something that you typically see weeks or months after a traumatic event and can last for years sometimes. It's a really, really tricky problem. Now, if you have ideas for topics for other videos for this Veteran Nexus Letter channels, injuries, risk factors, Nexus letters, anything else, leave those in the comments below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter, whatever your injury or condition was, click the link in the description below this video. You can learn more about working with me. We do everything we can. My team and I make the process as simple and as quick as we can for you, and I try really hard to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to working with you.